Thank you, Madam President. Madam President, I come to the floor today as someone who's practiced medicine in Wyoming, taking care of families all across the cowboy state for almost a quarter of a century. And I come as a doctor giving a second opinion, as I have done week after week, about this broken health care law that people all around the country are now very concerned about, and the impact it's going to have on their own personal lives. We started the whole discussion and debate about health care. The American people knew what they wanted. They wanted the care they need from a doctor that they want at a cost they can afford. And what we've gotten is something that provides not that at all. So, Madam President, I saw today in the Washington Post, under the headline Budget Showdown, comments about the President's speech yesterday to the nation. And he did talk about Medicare and did talk about Medicaid. And I believe that speech was very short, really inadequate on the details. And it was interesting to see what the Washington Post said about Medicaid. It said, the senior administration official speaking to reporters on the condition of anonymity. The details, he said, have not been worked out yet. So we have an anonymous source working in the White House, talking to reporters, admitting that the details have not been worked out. Well, yesterday people heard the President's speech on spending, but it seemed to be higher on political attacks than it was on substantive speech, the things that really we need to seriously be discussing and debating in this country about a huge debt problem with which we are living. The President did mention one bit of substance, though, that really should concern the American people. He said, quote, "We will slow the growth of Medicare costs by strengthening an independent commission of doctors, nurses, medical experts, and consumers who will look at all the evidence and recommend the best ways to reduce unnecessary spending while protecting access to the services seniors need." Well, what this is a Washington commission, a commission in the health care law that many know as IPAB. It may sound harmless. It stands for the Independent Payment Advisory Board, and Americans, I believe, need to know more about the details about how this will actually work. Many Americans may not remember that the health care law created this unelectable, unaccountable board of Washington bureaucrats who will be appointed by the President, and the sole purpose is to cut Medicare spending based on arbitrary budget targets. These are cuts above and beyond the $500 billion that was taken from a nearly bankrupt Medicare program, not to save Medicare for our seniors, but to create a whole new government entitlement program for someone else. This board empowers 15 unelected Washington bureaucrats to make these Medicare cuts, all without full transparency and accountability to American seniors and to elected officials. So, once again, this board proves that the President and the Democrats in Congress who voted for the health care law simply didn't have the political courage to make the tough spending decisions themselves. Instead, they took the easy road. They pulled the classic Washington maneuver: create a board and punt the decisions to them. Well, Congress gave this board its authority to manage Medicare spending. I didn't vote for it. Members on my side of the aisle didn't vote for it. But this is part of the health care law that was crammed down the throats of the American people. Congress abdicated its responsibility to explain to the American people specific payment changes necessary to keep Medicare solvent. Well, let's take a look at what happens when this board actually makes a recommendation. The recommendation becomes law. The recommendation becomes law. Now, how can we prevent that from becoming law? The recommendation will become law unless the House and the Senate each adopt, not by simple majority, each adopt by a 3/5 majority, a resolution to block them. That's not enough. First, you need 3/5 of the House, 3/5 of the Senate, resolutions to block what this board has recommended. And then the House and Senate have to pass legislation to achieve equivalent savings of what this board claims to be saving by the care that they deny. Well, this is an incredible concentration of power that should belong in Congress to a board of unelected individuals who are appointed by the President. Now, is there concern about this? Well, in the House of Representatives there is. There's been a repeal provision creating that would repeal this board. And I will tell you, Madam President, it is a bipartisanly co-sponsored attempt to repeal this provision. So that's what we're looking at now. Why? Because the President and the Democrats refused to take a leadership role and to just punt this down the road. They simply threw up their hands, said, let someone else do it. This is not health reform that is good for patients, for providers, the nurses and doctors who take care of those patients, or for the taxpayers. Well, fortunately, Senator Cornyn of Texas has introduced a Health Care Bureaucrats Elimination Act. This bill will repeal this board in order to ensure the doctor-patient relationship that is important to quality health care for all Americans is maintained. And I'm happy to co-sponsor that with Senator Cornyn. We will continue to fight to repeal and replace this very broken health care law. Thank you, Madam President. I yield the floor.